Hello, social workers of Alabama. How y'all doing today? Hope I cleared out my background. I'm over here being a perfectionist, and it's like, look, man, you just gotta shoot. You just gotta shoot. Gotta go. Gotta go. Let the chips fall where they may. We've got content to put out today. Want to put that content out, but first I want to grab my mic and say hello to everybody. And thank you for all y'all who have been supporting social workers of Alabama. Our community is growing large. We're almost at 4,000. So, but that's not what we are here for today. We're definitely here to thank you, but we're not here to just hear me running my mouth. We've got substance to talk about. And I want to talk to you today about some of what we talked about in supervision throughout the week up till today. And we were talking about these subjects, and we're going to be talking about harm reduction versus abstinence. Okay, compassion while working with addictions. Compassion while working with addictions. Are you in this for the right reason? Because a lot of times there's certain populations, right, that can be challenging. I know my experience in working uh, with individuals that are connected with the court system. They end up coming in through DHR, which is a good resource, by the way. I want to get into that. Good resource, especially if you're trying to build your private practice. Working with DHR and the reimbursement, that's another conversation. It's really good, believe it or not. But you've got to be passionate about working with these populations, with any population. Are you in it just for the money? Are you in it to help? So where's the compassion? Because depending on what approach, how you think about, okay, working with difficult clients. Like I said, we're working with domestic violence and seeing domestic violence. We see domestic violence cases or individuals. We work with anger management here. Some of you all may be working with individuals who have drug addictions are connected with the court. There are systems put in place to reduce the potential that they get locked up. But guess what? Based on how you view, because it's a whole thing, right, between harm reduction versus abstinence. And it's a big argument about that. What is harm reduction? Okay. We know what abstinence is, but what is harm reduction? And harm reduction is an approach to substance use that focuses on minimizing the negative consequences associated with drug use rather than solely focusing on eliminating drug use itself. So what are some examples of this? With harm reduction? Again, you got harm reduction versus abstinence. Some of you all believe the best approach is abstinence and there's no other way. In other words, lock them up. And we're going to see a video about this with Matthew Perry, with someone really approaching him aggressively about this. Depending on where you are as a social worker, as far as your view, it's gonna weigh heavily on how you provide therapy, how you provide intervention as a caseworker, because guess what? We're all over the place. Where are social workers in this system? We talked about drug court, because a lot of us aren't familiar with drug court. And in many minds, drug court is a situation that is considered coming from the harm reduction model. In other words, with drug court, the belief is that instead of just incarcerating someone because they use drugs, they're believing that we're not going to make drug use a I can't think of the terms. I'm live. But basically, we're looking at it a different way. We're looking at drug use as the correction, not meaning or being that we just lock you up. Because why? When you get locked up, what, 60, 80% of individuals incarcerated may have, I think at least 60% may, one study I was seeing, have drug addiction. So that may not be the best way. And so what the drug court does, a lot of us aren't aware of this, is they have social workers and mental health workers and everybody in place to support this person with going through certain protocols to reduce the level or the possibility of them staying drug addicted or being placed into the criminal justice system because they have an addiction. Now, if you don't like that, which is totally your it's okay if that's if you know, I'm not here to judge what you like, but there is an approach that we have to take in working with these people. But one of the things I wanted to mention, because we were highlighting where social workers are, and during this conversation, we just happened to have a social worker that had worked in the system doing all the stuff that I said that we do. But where are we in the system? You're looking for a job. Drug court case managers, substance abuse counselors, we're probation officers, we're court liaisons, we're family service social workers, we're case advocates, we're community resource coordinators and evaluators or researchers. This is what we're doing, right? And so if your person gets into the drug court situation, how do they get there? That was a question that I asked the supervisees. Do you know how we get there? And usually, obviously, or maybe not so obviously, if we're involved in this situation in the court system, okay, I mean with drug court, it's because we did something wrong, we got caught, and we're in the criminal justice system. Okay, so the things that we learned about is how do you get there, who gets you there, and how do you get help. But the problem is that sometimes we don't really know how to properly deal with these situations if we don't like the protocols for treatment. Where is the compassion in these situations? And we have to understand, if there's certain things you don't like, you can get out. You can quit. But the thing is you can hold on to your beliefs while still looking at the soul. They need compassion. And if you're in social work and you're not about compassion, then there's a problem. Real quick, I want to highlight before I jump into this, because we're going to bring some video into this and want to show some scenarios here. But I want to invite y'all. We have a free CEU coming up that we would love for you to join and attend. And of course, as usual, I'm having problems finding where this one is, but we've got a CEU training coming up very shortly. I think this is it. Okay, yes. All right. And give me 1 minute to go through that. Free. If you're a part of Social Workers Alabama, that is. I'm sorry. But gaining the social work benefits, the importance of the NASW. And this is going to be presented to you as free by none other than Miss L. Renee. Okay. L. Renee Ross. And we're excited about that. We had about 100 people attend our last CU training. And so we appreciate y'all supporting us. Come on through. If you're looking for to be a social work supervisor, we've got a training for you on November 11th. Come through. It's an online training. And then if you are LICSW and you know that it's time to get that required training for the DSM that everybody has to have, come check ours out. All right. And this is the one that we have. You can do it on demand, and we have some great speakers. Let's get back into what we're talking about today. Okay. Let's get back into this argument. So some of you are familiar with Matthew Perry. Matthew Perry passed recently, and I understand it was due to complications with maybe an overdose with ketamine. And I was seeing something that about 2 days ago, it looks like that the doctor or a few of the doctors that were involved with that are pleading guilty. But in this video, you're going to see the debate here between harm reduction versus abstinence. And we're going to see an example of how not to treat someone who is addicted, because I'm sure this individual didn't think that, maybe at some point he would be deceased because he just wasn't able to get over this. And this is the way that we've got to see it. Yes, people need to stop what they're doing, but sometimes it's just not that simple. And some of us don't really want to know why and how difficult it is, because if you knew why and how difficult it is to overcome this, you would be them. And a lot of times that might mean that you were that person that was raped, or that person that was abused, or that person that was neglected. So sometimes we just need to kind of listen to what they say, even though we don't agree. We need to listen. Let me share this video. I thought this was kind of out there, but this is before Perry passed. And here you're seeing demonstrated the two separate belief systems when we're talking about maybe a harm reduction model versus abstinence. Let's see if we can check this out.
Your point is to stop drugs and alcoholism by just people never starting?
Well, you two believe in this fantasy of addiction in which people lose
Fantasy of
a
addiction.
complete fantasy in which people lose all power over themselves and become victims of this terrible, frightening disease.
But right now you're quoting.
Let me finish. This is what you believe: this terrible, frightening disease after which they cannot stop taking drugs. If you really believe that, then you would presumably think the best thing would be that they never ever came in contact with those drugs.
Of course.
Wouldn't it therefore be wise to deter them from doing so by a stern and effective criminal justice system which actually persuaded them it was unwise to take the drugs in the first place?
When do I get to speak?
Right.
I'm dying to speak.
If you really believe in it, you'd agree with me.
When can I speak?
Speak.
Okay, so...
I didn't come here to be quiet.
Neither did I.
No,
I didn't come here to listen to ludicrous things like that either. So
well, you tell me why it's ludicrous if you're so clever.
I will. The American Medical Association diagnosed it a disease in 1976, so you're saying that that's incorrect?
Yeah, look, people...
Are you saying that that's
the
incorrect?
medical profession is constantly doing extraordinary things. The American Psychiatric Association said for years that homosexuality was a disease.
the key thing is...
They were wrong. All kinds of things are said by medical
the
professionals.
key thing is we've had this policy for 50 years. We've had this policy
My life.
of
My life is the objective
of treating
evidence.
addiction as a crime. 50 years.
No, we
and we
haven't.
now know that it doesn't work. It doesn't work anywhere in the world. Increasingly in the US, Uruguay, and elsewhere, and in Europe,
Finish your
things
point,
are changing.
My life is, I'm a drug addict. I'm a person that if I have a drink, I can't stop. And so it would be following your ideology that I'm choosing to do that. That I'm choosing.
That's exactly not my ideology, it is my belief. Yes, you do choose.
It is, and
You have a
it's
choice.
a belief that you wrote in your book, correct?
You have a choice over whether you drink or not. You have a choice over.
But your book is the only book in modern times that has this ideology.
Yeah.
So doesn't that teach you something?
Well, it's quite often unfashionable ideas are unfashionable because they are unpopular with influential people. Doesn't necessarily bother me. You tell me what the objective diagnosis is to establish the existence of addiction in the human body.
It's an allergy of the body, and it's an...
Allergies of what?
We're supposed to be grown men here, and you're making faces like the guy who's wearing the pants that you were talking about earlier. I'm expecting you to come out in the pants in a minute.
Okay. So this is an example of how not to approach the situation, regardless of our belief system. Maybe it was true that Perry was in denial. Maybe it was true that he does have choice. But how do we treat these individuals in the setting where they come and are needing help? It's important to put away our own personal biases in order to properly treat and assess. Okay? Where is the empathy? This is something that we are taught as social workers. Empathy, okay? Where is the empathy in this situation? But let's just say that there is denial, because I'm not going to lie. On another side, we're working with DV clients, lots of denial. As a matter of fact, with most of my DV clients, domestic violence, it would take probably 4 to 5 sessions just to get to the point of accountability. And that can be grueling if you don't put away your own personal biases. But I want to show a video that might help to support us if we have gotten to the point to where we're working with a client and we can't overcome the fact that they're in denial. How do we respond to someone that is in denial? Could be with DV, could be with someone who's in drug court, could be another case similar. How do we deal with them? How do we show the compassion that's needed? And it's going to need to be taking place, the compassion and empathy, or you're not going to really be very effective with a win for the person. And I asked this question: what's the number one reason why someone maybe that ends up in drug court or some type of addiction treatment? What's one of the number one reasons why they might need to go through this process? And I think sometimes we miss that, okay, we focus on, if they go through drug court, it's to save them from going jail. No, it's actually to save their lives. It's been statistically shown through some statistics that they have a 50% more chance of survival or something of that nature if sorry about that, just does that sometimes. Survival if they go through a program or programs such as this. So the thing is, it's a safety issue. It's a life and death issue when we're looking at this. But let's just see, because sometimes I'm not gonna lie, it's hard to deal with individuals who don't seem to want to help themselves. And if you worked in addictions, you work with the court system and things like that, you have clients many times. It can frustrate you. But how do we navigate through that? We're gonna look at that, and then we're gonna close out here. We're gonna close out. All right. This is like 2 minutes.
Because people, whether they have addiction or mental illness or anything else going on with them, often don't want to admit to themselves that there's a problem. And in the addictions field, there's been this whole thing, we got to break through denial and everything like that. Well, people have denial for good reasons. If we didn't have denial, everybody would be sitting around obsessing about death, or at least I would be. It's a defense mechanism because we need defending. So recognizing that can allow you to approach somebody not from an attacking stance, approach somebody from a befriending sort of stance. And that is hard to do, and some people are going to get very defensive no matter what you do, and it's not going to be a pleasant conversation most of the time, but you can minimize harm. I mean, this whole thing always comes down to like reducing harm, making things less unpleasant if you can't make them non-unpleasant or actually pleasant. So it's really, but the main thing is like, see them as a full human being. And I think really important in getting people into any kind of treatment is that, I always say this to parents or anybody who has an addicted loved one, the first step should always be a complete, thorough psychiatric evaluation by somebody who is not affiliated.
Okay. And so there's where it is. A lot of times this may be difficult for us as clinicians, because especially if you are full of caseloads, you're full of people that just seems like they're being manipulative, playing games, don't want to help themselves, things like that. We still have to step back. We might have to get our own counseling, have to get our own intervention, recognizing that this is a full human being and we are in here to help. Well, this is what we talked about, among other things, during our supervision sessions this week. And I just glad to share that with you all. Hoping to see you again next week. For those of you all who tuned in, check us out on next week, and we'll have some more content. God willing, he put something in my head, and we'll take it from there. Y'all take care and have a good one. Bye-bye.